somebody at home somewhere that doesn't feel good, isn't breathing well, they're coming to the ER and you are the first line of defense.
Correct.
What does the person that comes into the door that feels that they have corona, what are their symptoms? What do they look like? What do they feel like? Is everybody the same?
Everybody's not the same. For instance, initially when people contract corona, it may take anywhere from 2 to 14 days before they become symptomatic. At that time, the virus is in incubation, meaning that they are infected, but not to the degree there's not enough virus that is replicated in their body to cause symptoms. After, say, the 14th day, sometimes after 2 days, they start to have a fever, a dry cough. They also can have initially nausea and diarrhea. The nausea and diarrhea, we're finding out, are some of the first symptoms, even before the fever and the cough. The crowning symptom is a shortness of breath, which begins to occur between, say, 7 to 11 days. What happens is that the virus, after it has infected a person, it causes the body to produce what we call inflammatory mediators. They're around the 11th to 7th day, there's what we call a cytokinin storm, meaning that these mediators come out, they start to cause the lungs to fill with fluid, they cause inflammation in the lungs, and of course then breathing becomes very difficult. That's where these drugs that Trump was talking about, President Trump, come in, the Plaquenil, hydroxychloroquine, because they act as an anti-inflammatory. They kind of block the mediation of these inflammatory mechanisms that the body is starting to fight the infection. One of the things that we're seeing in the hospital, if we can get patients in early enough, we can start them on, of course, antibiotics. We also see that they have bilateral pneumonia. So we'll start them on the antibiotics, and there's a very characteristic appearance to this pneumonia. It's kind of like a glass ground appearance in the upper lobes of the lung. And this is what we're seeing frequently with corona patients.
A glass ground appearance? Say that again?
It's like a glass ground appearance. In other words, it looks like ground glass that we're seeing on X-ray in the lung.
And so there are people who have come into the ER, from what I understand, who also have pneumonia, who, again, at that time, if you find out that they have pneumonia, you're also looking at their lungs. If they have pneumonia, are you able to see that as well, even before taking an actual COVID test? If you look at the lung and you're saying that you can see these glass, looks like brown glass in the lungs, if they're being screened for pneumonia, can you see COVID, or should you be able to see COVID at the same time?
Once we see this glass ground appearance, we look for a few things, and if we find these things, it's what's called pathognomonic for COVID. If we see that they have a white cell count, which is either normal or low, if we see that their lymphocytes are also low, if we see that their CRP, C-reactive protein, is elevated, that their ferritin level is elevated, almost without even getting a corona test, that's kind of pathognomonic for COVID, along with the ground glass.
So if you see pneumonia come into you being on the front line, I've seen people go in and they have pneumonia, but they are not tested for COVID. They are given medicine for pneumonia and sent home. But should they be tested if they have pneumonia?
If they have pneumonia,
a lot of people say that pneumonia leads to it, like a week or so later, they went in with pneumonia and they went home with the medicine, and then a week later, we have another issue.
Anybody that comes in with pneumonia and a high fever, they're going to be tested for COVID. Now, the problem with the testing heretofore has been there are some places around the country that have a 5 to 7 day return on the test. Other places have come out, labs have come out with a 24-hour return, and it depends on where you are as to whether or not you have access to a 5 to 7 day return or a 24-hour return. The other thing is that they are in the process of manufacturing these reagents for these tests. So right now, even on the 24-hour test, they don't have enough of them manufactured to spread them across the country. This is why you're seeing that states are testing sometimes, or they want to get to the point to where they can test 1,000 a day, 10,000 a week, because they have to wait for these tests to be manufactured before they can distribute them.
Dr. Buckles, I see you shaking your head. Go ahead and jump in here, Dr. Buckles.
Dr. K, he's in the hospital, but I'm the ER doctor. So what happens, Nisha, is that if you come in and if we do an X-ray and I see this brown glass appearance and you have a fever and you have a respiratory problem, we're gonna test you because we have to prepare ourselves to go into the room, our PPEs, okay, before we go into the room to test you. And then I'm gonna put you in the hospital. If you got a glass appearance, I'm gonna put you in the hospital. I'm concerned that you're gonna have respiratory distress and you're gonna need a ventilator soon, okay? If you come in and say your oxygen level is 80% on room air, and I give you 2 liters and it goes up to 82%, it's not clamming a lot. Your normal oxygen should be 96 to 100%, 98% on air, okay? If I give you 5 liters of oxygen and you're still below 90%, I'm most likely gonna say you need to be put in the hospital because you probably gonna need to be ventilated very soon, okay? So I do test people. When people come in, I think they may have COVID-19. If you have a fever and I find pneumonia, or I find strep throat, or I find a UTI, I'm going to treat those symptoms. I'm going to test you for COVID-19. I'm going to send you back home and tell you to return if you get these things, respiratory distress. But I'm going to tell you, I'm going to send you home to be quarantine yourself until the tests come back. It may take a day, 2 days, whatever days. You quarantine yourself, and we will call you. So everybody's not put in the hospital because you got a fever or you got pneumonia or stuff like that. Because we don't have enough supplies or enough
right.
beds